Welcome to Visu Online Training. Today we are going to discuss about selection of PDX, acute GI bleed versus anemia. Okay, when acute GI bleed and anemia, both conditions are reason for admission. Okay, what we need to check? Okay, here acute GI bleed. We need to check site of bleeding, cause of source, clinical sciences, vital signs, lab results, imaging, treatment provided, associate conditions, complications, link between bleed and anemia. Next, anemia. Type and cause of anemia, lab values, severity, symptoms, treatment, underlying conditions, whether acute or chronic. Okay. Now we are going to discuss about PD selections. Okay. Now, when both the conditions are reason for admission, the clearly physician stated like acute GI bleed, acute blood loss anemia. Physician is giving treatment for transfusions for anemia, acute GI bleed, they have done EGD, they given treatment for IV proteinics. So both the conditions are reason for admission, both the conditions are getting treatment equally, both the conditions are managed by physician. Okay, this time we have to go with the higher weightage. Another scenario, if the patient is admitted with only acute GI bleed, they mention like melena or hematohemesis, hematochezia. In ED physician, they mention like in MDM note clearly they stating about GA bleed. Primary impression clearly mentioned like GA bleed. In HNP physical note, consultation notes, and every EGD note, all notes. Physician is speaking about acute GA bleed. They have done EGD. They found source of GA bleed like esophagitis, gastritis, or any peptic ulcer disease. So this is a clear source of GA bleed. So here the PDX will be GA bleed. And next scenario, patient is admitted with only anemia, low hemoglobin levels, low hematocrit. Clearly the physician is documented patient is getting dizziness and shortness of breath, palpitations. They have done transfusion in ED. All HNP progress note, consultation notes, and discharge summary clearly physician is stating about anemia, acute blood loss anemia, or whatever type of anemia. Okay, the clearly reason for admission anemia, getting treatment transfusions, folates, and any ferrous sulfates. Okay, any B12 complex tablets. Okay, these kind of treatment and focus of management is going for only anemia. Anemia will be the PDX. Okay, that's all, guys. Yeah. Clinical presentation: hematemesis, melena, dizziness, weakness, syncope, hypotension, and tachycardia. For anemia, common causes are acute and chronic blood loss, iron deficiency, vitamin B12, anemia of chronic disease, hemolytic anemia, bone marrow disorders, renal failure. Clinical presentation is fatigue, weakness, pallor, shortness of breath, dizziness, tachycardia, or chest pain. Okay.